Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today we are going to talk about bug bites, how to prevent them, and how to treat them. Bug bites can be from many different types of insects. I'm going to go over the most common ones, such as mosquitoes, bees, and ticks. However, there are so many different types of insects and bites. This is going to be general advice, what I give to my patients every day in the summer when this topic comes up all the time. It's not going to be an encyclopedia of bug bites, but a conglomeration of my general advice and instruction. So bug bites are usually red and swollen skin, often hive-like, usually very itchy, sometimes painful. They can occasionally even have blisters on them. However, the classic rash of Lyme disease is different than that. It is a bullseye-shaped rash. You can often see a little punctum in the middle or a scab where the tick has bitten somebody. And the Lyme disease rash is often asymptomatic, and sometimes people barely notice it. So bug bites can really look very different. Sometimes there's only one, sometimes there are several, sometimes the diagnosis is honestly difficult to make. But I'd like to dive right in as to how we prevent them. So how do we prevent bug bites? First of all, try to avoid being outdoors with uncovered skin, dawn and dusk, when the bugs tend to be out more and bite more, especially mosquitoes. If you do need to be outside, wear long sleeves and long pants and socks. If you cannot cover up, then that is where the bug repellent comes in. So let's dive into that topic. Bug repellent. There are two main chemicals that work well to repel bugs. One is DEET, D-E-E-T, and the other is Picaridin. Usually 20 to 40% DEET works well. You need to actually look at the label. There's often family-friendly repellents that are 7 to 9% DEET that really don't work that well. But, it's up to you if you want to use the chemical on your skin. Picaridin is usually 20% and also works well. Either way, these chemicals work to repel bugs. However, it is also possible to spray your clothing, which many people do not know, and I learned a number of years ago, and you can spray your clothing with bug repellent clothing spray that has permethrin in it. And what we will often do before the summer, especially for kids who are going to be outside or in summer camp, is take all the clothing that they're going to wear and lay it out on the deck, the patio, outside, on the pavement, and spray the front, let it dry, flip it over, spray the back. I will include socks, but not underwear in this project. And then you throw it all in the laundry, launder it, and wear it all summer. It usually says how many washings I believe it will last through on the bottle. But if you have particular clothing that you wear outside all the time, you're a hiker or you're a gardener, or you're playing golf and you're in the woods, you can spray that clothes in advance of the season, and it really helps. I'd like to briefly mention bee stings. Bee stings are very painful, and basically, how do you prevent them? It's often that we just have bothered the bee unknowingly, and it stings us. So basically, if you see a beehive, don't bother it and stay away from it. That is my advice on trying to avoid bee stings. Trying to avoid tick bites is a different whole story. Tick bites are difficult because the ticks are so small we often don't see them. So it's mostly about wearing the proper clothing when you're out. You really want to be fully covered. Famously, you should tuck your pants into your socks, which may look silly but is very effective. And also bug spray helps. And you can put the bug spray on your skin and also on your clothes, as I just discussed. For tick bites, it's also really important to check your skin of yourself or your family when you're back from your outdoor activity. And again, the ticks are very small, so sometimes you can't even see them that day. So it's good to check your skin for at least a day or two after you know that you've been outside and exposed to ticks. Some people who have dogs, sometimes the ticks can come in on the dogs. You could check yourself every day in the summertime or in the season of Lyme disease. So if you do find a tick on yourself, you would want to try to remove it with tweezers. And I would hold on to the tick because it can be tested, not per se to see if the tick has Lyme disease, but to see if it's a type of tick that carries Lyme disease. And then you can decide what kind of treatment you need to have with your doctor, depending on how long the tick was on you. There are particular protocols that can be looked up by the CDC, issues them, and sometimes they change. So I'm not going to go into the details of them right now, but it's good to save the tick if you can. If you do end up with the classic bullseye rash of Lyme disease, you can see your doctor for treatment, which is usually doxycycline, which is an oral antibiotic. There are other antibiotics that can work, but doxycycline is the best. And if you have a rash or a fever and are not feeling well or have joint pains, then those can be signs of Lyme disease or a tick-borne illness. Definitely seek medical attention. For regular bug bites, how do you treat them? Basically, ice, cold compresses, antihistamines like oral Benadryl or Allegra, Zyrtec, Claritin, etc. Those are all over the counter. You can use topical steroids like hydrocortisone 2 to 3 times a day. You can also purchase anti-itch lotions at the drugstore, such as Sarna lotion is one particular brand, Sarna, but there are others. In summary, bug bites can be from many different types of bugs. This was not an exhaustive list. It was just a list of the most common ones that I see in my office. And the best thing is to avoid being outside with uncovered skin for dawn and dusk, to wear bug repellent on your skin and potentially on your clothing. Also to wear protective clothing for woodsy or grassy activities to avoid tick bites, and to check yourself and your family for ticks in the evening and the next day or two after you potentially were exposed. The best bug repellents are DEET, D-E-E-T, and Picaridin. The best clothing repellent is a Permethrin spray. These can all be bought online or a local camping store or sometimes in a drugstore or a hardware type store. If you do get a bite, ice it, take antihistamines if you can, use cortisone and anti-itch creams, and if you need medical attention for a bite or think you have Lyme disease, contact your doctor or dermatologist or urgent care center. I hope that was helpful. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.